In line with the new leadership vision to take a more hands-on approach in coordinating and monitoring the HIV response, the National Agency for the Control of AIDS, NACA, initiated a series of familiarization visits to states across the country. Led by the Director General, Dr. Temitope Ilori, the delegation's first point of call was Oyo State, a frontline state in the fight against HIV and AIDS, commencing at the state's Ministry of Health.
We don't just want to sit back in the office. We want to know, what is happening at the end users, what is happening in our facilities, what our people, both living with HIV/AIDS and even those affected with HIV/AIDS, what they're going through, what are the facilities, available to them, how accessible are these facilities available to them, and how conducive, are these facilities. And that is why we are here. We want to see things by ourselves. Of course, we are all very aware that NACA is the agency responsible for coordinating both the health and the non-health response, of HIV/AIDS in the country. And of course, we have SACA in all the 36+1 states of the Federation. But I'm very familiar and I'm very aware that Oyo State SACA is one of the leading SACA in the Federation. I give kudos to you, and I say, please keep up the good job. However, as that may be, we would always ask for more.
Dr. Ilori encouraged the State Ministry of Health to align with the federal government's sustainability agenda and prioritize prevention of mother-to-child transmission of HIV.
At the national level, we're looking at what we call sustainability agenda. So we have our new business model, which we refer to as Alignment 2.0. And the whole essence is that we are looking at government resources taking over, because the partners will not always be there with us. So we are working towards this, and we're also enjoying our states and even the local government to work towards this sustainable agenda. In the area of prevention of mother-to-child transmission, it's unfortunate that Nigeria still has the highest burden of children born with HIV/AIDS, and therefore this is a key priority area where we want to work assiduously. So we are going to increase our advocacy, increase our sensitization. So we are going to reach out not only to the health workers, but even also to our mission homes, our religious leaders, our traditional leaders. The birth attendants will not be left behind, and therefore we call on everybody to come on board, and try to stem the tide of HIV/AIDS and meet the target that says by 2030, HIV/AIDS should no longer be a public health threat.
The Commissioner for Health, Dr. Oluwaserimi Ajetumobi, in her response, congratulated Dr. Ilori on her appointment and pledged the state's support to the HIV response.
So far, so good. We have been setting the pace. But you know that to whom much is given, much is expected. We also know that much is expected from us as far as the sustainability plan is concerned. Because we know that all our implementers at one time or the other, they are going to go. But we are going to be left with the situation. And you don't want the progress that we have achieved so far to go down. So part of the things that we plan to do also is this community awareness, community engagement, and also to involve the religious leaders, all our imams, all our clergies, to preach it in the church, say it in the mosque, for people to take ownership of their health, take ownership of whatever is happening to them. While on the part of the government, we are trying to work out the sustainability plan, bringing the care into the regular or routine clinic. You are coming to the hospital maybe to access care for hypertension, and you have the disease. Part of what they do is counsel you, give you education, get your drugs, get your medication. So as you are getting it for hypertension, you are also getting it for the disease. And by so doing, we are going to like an integrated kind of approach to management. And I pray and I wish and I hope that we are getting there by His grace.
To gain deeper insight into the state's HIV response efforts at the grassroots level, the delegation proceeded to the Oyo State Agency for the Control of AIDS, OY-SACA. The project manager of OY-SACA, Dr. Olalere Olajide, welcomed the NACA delegation and proceeded to highlight some of the key achievements and challenges faced by the state in its ongoing HIV response efforts.
Of course, we have our challenges. We want to coordinate better, but we how do I coordinate, bring down 33 NACA managers from different local governments. Very far, some will travel like 4 or 5 hours to this place. And I won't be able to give them anything. Those are the challenges that we face. But then, we have come up with the fact that, okay, even if we cannot do those ones, the ones that majorly the people that will participate in Ibadan or go ahead now. But all those other meetings that you have to bring people in is a bit difficult. If we have a form of support in that line, that would be great. The issue of test kits is a major thing. But once they are on, it's never enough, especially for the general population.
Commending OY-SACA for its efforts, the NACA Southwest Zonal Coordinator emphasized the importance of accurate and timely data in guiding evidence-based decision-making.
So Oyo is doing very well, and I can only say they can do more because the largest room is the room for improvement. So, and also our data needs to come. If we're doing a lot and we don't have data to address it, whatever is not documented is as good as not done. So I want to implore the state's response team to have accurate data that we can showcase everywhere in the world.
The deliberations yielded positive outcomes, with both parties reaffirming their commitment to a collaborative approach to combat HIV and AIDS. Naturally, the tour included a nostalgic visit to Dr. Ilori's academic and professional roots at the University College Hospital, where she once served as a consultant family physician.
We are very excited to receive you, especially the main purpose of your coming, which is to look at how HIV/AIDS is being managed. Of course, even now, HIV/AIDS is still a public health problem or issue. And like you said, that the prevalence has been going down the world over. However, it's going down because of the concerted effort that government is making. So it is not the time to withdraw or rest on our course. The battle is not yet won. So we have to keep trying and following all the dictates that the international community have followed. So on this note, I would like to thank you most sincerely for calling on the management of the University College Hospital, looking at us as to what we are doing. We hope to have your feedback so that if there are areas we need to scale up our activities or improve. I promise you we are willing to do that. On behalf of the management, staff, students, and patients of the university, I wish to present this plan to you. Show our gratitude for coming, and they wish you well. We are new and God bless you.
The visit to Oyo State underscores NACA's unwavering commitment to strengthening collaborative efforts with subnational governments in advancing Nigeria's ownership and sustainability agenda of the HIV response.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng.